Selangor branch. Welcome to our first of a series of webinars organized by the MMA Selangor, led by SCOMO Selangor. Over this year, we're going to come up with a number of highly relevant topics relating to nation building, which will allow our participants to ponder, dissect, and discuss about. We also hope to raise awareness about important topics which healthcare professionals should champion, and also aim to get healthcare professionals involved in the advocacy of said topics for the betterment of the nation's health. For the next hour or so, I will bring you on a journey to discuss the pandemic's burden towards healthcare professionals with our prominent speakers. But before we begin, I would like to invite the chairman of MMA Selangor, Dr. Krishna Kumaran, to officiate our webinar series with a speech. Dr. Krishna?
Thank you, Sean. Good evening and warm welcome to all. Firstly, I would like to thank the SCOMO Selangor for inviting me for this welcoming speech, and hats off for them in organizing the monthly webinar series revolving around healthcare policies and issues. Today is our first webinar discussing on mental health burden on healthcare during the pandemic. The mental health impact of a disease outbreak is usually neglected during pandemic. Although the consequences are very costly, we need to create awareness to commit to concrete investment in mental health and psychosocial support. I hope through this webinar will give us the opportunity to shine a light on this important issue. I wish smooth running of this webinar and hope all participants benefit from my esteemed speakers. Before I end, I would like to say that there's no health without mental health. Thank you.
Thank you, Dr. Krishna, for the short and succinct speech. It is wonderful that we get to have you here with us tonight, and we hope that all subsequent events will get the support of you and the team as well. Without further ado, let me introduce our first prominent speaker tonight. First up is Dr. Juliet Matthew. Now, I think the involvement of Dr. Juliet is very important because we are witnessing the strong support of MMA Selangor team in this webinar series. Dr. Juliet is the Vice Chairperson of MMA Selangor, and her support has been very much appreciated in the setting out of this series. She concurrently holds two important roles. Firstly, as the registered counsellor, and secondly, as a lecturer at the International Medical University. And we hope to get a valuable insight to the impact of the pandemic towards our healthcare professionals. Dr. Juliet, I pass this to you. Dr. Juliet, you are muted. You have to unmute yourself.
Good evening, everyone. Can you hear me, Sean?
Yep, very clear.
Right. Good evening, everyone. And I'd like to start this by validating what Dr. Krishna just now said. There's no health without mental health. So I'm going to start sharing my slideshow now, just a little monologue of what I've prepared for all of us today. Can you see this, Sean? Just a moment.
Just a moment. Let's sort this out. Are you screen sharing?
Yes. Are you able to see?
Very good. Very good.
Okay, so there you go. So, good evening, everyone. Before 2020 itself, mental disorders were leading causes of the global health-related burden, with depression, anxiety disorders being the leading contributors to these burdens. So with the emergence of COVID-19 pandemic, in this environment, there has been more determinants of poor mental health. And so today, I'm going to zoom in to talk to you all briefly about this. The pandemic's burden towards healthcare professionals, the impact of COVID-19 on healthcare resources, and more interestingly, and the budget just came out just now as I was preparing the slides, what the government can do for us doctors. Yeah. So during any health crisis itself, healthcare services are placed under excess pressure, making working life very stressful than normal. The COVID-19 pandemic is a major health crisis, and this has changed life of millions globally. We know that, right? And in that, the burden towards the healthcare professionals has been that there's increased stress at work. Yeah, with the number of patients growing, the additional strain on all the resources that are available, shortage of PPEs, and the warranted, perceived, and real risk of infection. If you look at the meta-analysis done on the 2009 swine flu pandemic, the influenza A, H1N1, it says that the odds of any healthcare personnel contracting the virus is twice that of normal folks. So with this perceived and true risk of infection, and doctors do have a greater risk, not just to self, but also to their families. Now to add to this, don't forget the different new aspects of burden that doctors experience during this time. Bereavement, the inability to grieve openly, isolation, loss of income for many, and the fear. Factors that are triggering mental health conditions or exacerbating the already existing ones. Okay. So let's see what are the impact of COVID on healthcare resources. Now, there has been many restrictive orders and temporary ad hoc programs and changes within the healthcare and other supportive systems that were implemented in response to the COVID-19 pandemic in Malaysia. Now, this not only caused a lot of chaos, but it sidelined people who are getting general health care and other supportive services, including those who are receiving mental health care. Now, there were, of course, in addition to that, all the insufficient knowledge among healthcare workers about COVID-19 itself. So what more about the mental health issues that crops up because of that? I remember a very tired anesthetist, a very good friend of mine, after serving COVID-19 patients relentlessly within a local public hospital, saying that she wishes that bolts of lightning will strike whoever flouts the MCO. And basically, because she was just tired, the general public had no knowledge about COVID-19 and its precautionary measures. The doctors lacked training on how to assist people with COVID-19 illnesses in the aspects of psychological distress, and the whole show was a big fatigue stress on doctors. So let's see what are some of the strains that doctors do have. They experience high levels of work stress even under normal circumstances, and yet you will realize many doctors are reluctant to disclose mental health difficulties or seek help for them. And guess why? The stigma cited with it, right? So with this coronavirus disease, there is additional pressure on doctors, on the healthcare system, and general research up to now from March last year shows that such pressure does bring not just immediate, but ongoing psychological distress for doctors. Now, studies have generally shown also that many doctors find it difficult to talk about this. So why do doctors not talk about mental health issues? Basically, they are also very reluctant to get professional help. And I'll tell you why. The Malaysian culture or our Asian culture of stigma. Imagine doctors talking about suicidal ideation. How strong that can stigmatize a doctor's career, right? Research also shows that doctors would rather seek help from friends and family than look for psychological or psychiatric consultation. Yeah, and this is because they're worried about their career prospects, the stigma that comes with it. Even then, even with that, there are studies that show that they are even reluctant to disclose mental health problems to good friends or family. Again, the stigma of being ridiculed or dissed. And we know that's very common in this culture, right? You are a doctor and you don't know how to handle this. What like you? The common phrases that come out from general folks who do not understand the real stress doctors actually go through at this moment. Yeah. So when it comes to facing mental health challenges, we know that from previous epidemics such as the SARS outbreak from 2003, even the MERS epidemic from 2012, that healthcare professionals can experience a very broad range of psychological morbidities, including trauma. And this can be endured for months. Yeah, it can increase suicidal ideation. And we have heard of many cases where this psychological distress has been caused not just by the fear of contracting the COVID, but also due to social isolation, right? And these negative effects on mental health are found irrespective whether it worked directly or not with an infected patient. Now, the strains of frontline healthcare during an infectious outbreak can also lead to many sickness absence and higher staff turnover. But in our profession, studies and most evidence shows that doctors and nurses feel a strong professional obligation to continue working despite the danger. Yeah. And then last but not least, there's always the pressure to perform, right? I'd like to introduce a new term here today, presentism or sickness present, the act of showing up for work without being productive, generally because of ill health. It is not a new phenomenon because anyone who's dragged themselves to work with a splitting headache can tell you what this is. And according to research, doctors have the highest risk of this when compared with the range of other occupational groups. And then having to balance their own safety with the needs of patients amidst limited resources can all lead to very distressing ethical dilemmas for doctors and potentially what we fear and call the moral injury. Yeah? Moral injury is when you have a certain ethical or moral value and you have to go against that to make certain decisions. Switching off the ventilator is one good example, right? So here I need to highlight, since the beginning of MCO, the many heart-wrenching videos that I had actually received of doctors and nurses needing to go through unexpected, overwhelming moments, right? But studies have shown that at this moment of moral injury, the negative mental health can actually be halted if there is a good support system provided by the peers, by the employers. And so that's where I'm coming to, ladies and gentlemen, the support for doctors, right? What can we do for doctors in this period of time? Of course, a very strong leadership and support is very wishful thinking under the circumstances of our government state at this moment, but we'll not talk much about that. There are also many ways to tackle mental health stigma in the workplace. Now, the foundation of this is creating a culture that encourages open communication, and this will reduce the stigmatization to psychological vulnerability, right? So therein we can have activities that challenge unhelpful attitudes, have once a month sharing with colleagues about what's going on at work, what's going on inside, what's going on in your mind, and talking about mental health openly, right? So this could be immediate needs that can be done to support the doctors in the field, especially young doctors who are just coming in, graduating, starting the field and serving COVID patients. Can you imagine the kind of fear that they are under? For long-term needs, I would propose that the government, the organizations, whoever, start looking into setting up a good support system, a support network of counselors, psychologists, psychiatrists, all the sole aim of supporting physicians during not just this COVID era, but any era. Okay. A good staff mental health support process should be initiated under the healthcare, I believe, and it should be an ongoing agenda. This is the time to start. This is the time to implement this. Employer support for healthcare professionals and even during disaster management can actually be very protective, right? So healthcare professionals' motivation and morale are seen to be highly improved when they perceive that, one, their efforts are being recognized, and two, when their efforts are actually being reciprocated by employers or the authorities in any small way, some validation. So the factors are important not just for motivation and validation and good work turnout, but also to better the psychological outcomes. It makes the day spent at work worth the effort. Yeah. So ladies and gentlemen, think of all the doctors out there now, especially the young, the very young and the very old who are out there as frontliners right now as I speak. Think of their fears of contracting the virus at any point and transmitting it to their own families and loved ones. Think of their fatigue, their mental fatigue, the physical fatigue as they strive to serve their patients. Think of their earning capacity as they fight this pandemic, helping the public while still trying to make a decent living that has been disrupted due to the MCO. Think of all these doctors' future. Think of the uncertainty that they live in, we all live in, the fear of unknown. Time and time again, MMA has supported this. Many talks for contract doctors, increased pay grades, on-call payments, public doctor lists. Just now, I think this evening, I received the budget 2022 from a good friend and realized, yes, something is happening, but more needs to be happening, ladies and gentlemen. More things need to be happening for our doctors. And here, I'm hoping that we will truly take in the Malaysia Boleh concept and move forward. I would like to put this slide up for you all to see and ponder upon. Imagine boarding a plane and being told that the pilot has been working for the last 24 hours and hasn't had a wink of sleep, hasn't eaten for the last few days, or this is the third time the pilot is doing so. Would you board that plane? Why is it okay for a doctor to do that? We are superheroes, doctors. We are perceived as superheroes. But mental health challenges are increasing among the frontliners, among doctors, and this needs to be looked into. Yeah. So the government, healthcare managers should be aware of the potential for the COVID-19 outbreak and any other crisis that we might face in the future to elevate the risk of psychological distress and suicidal ideation in doctors. So we need definitely effective leadership, workplace interventions that on the ground level will reduce mental health stigma and promote sharing support for colleagues, simple tasks of just training on active listening among colleagues can help solve a lot of problems. And hopefully, this COVID era can serve as the beginning for mental health provision within our ministry. And there I'm hoping again for the Malaysia Boleh concept to set this into motion. So with that, ladies and gentlemen, I finish and conclude my talk for today.
Thank you, Dr. Juliet. A few things of note in budget 2022. Mental health services have received an increase in allocation from last year's 34 million, if I'm not mistaken, to this year's 70 million. That's a big jump. Under the KKM budget as well, we have also gotten a slight increase from 313 million to 319, which is okay. I mean, there's some increase. The unfortunate part is that under perubatan, there has been scarce increase in the bilangan jawatan. So from this year and last year, we have not seen increase. So if you are talking about one point that you made just now was actually about increasing number of counselors, psychologists, and psychiatrists. But the thing is, if our jawatan is not increased, that means we don't get to increase our manpower. And in the face of that, we are facing the silent pandemic of mental health right now. It may be a bit more, the burden for existing staff may be a little bit higher. Okay, so this is just a point to note for this page. Okay, we do have questions, but I think we are going to take all these questions later at the end of the session. Ladies and gentlemen, if you do have questions, many questions that you would wish our panelists today to answer, please put them in the Q&A box, or please put the comments under the YouTube or Facebook comment boxes. We'll let you rest a little while. I'm going to invite Miss Nur Ajira Abdul Manaf here today. Miss Ajira Abdul Manaf, is a clinical psychologist at Hospital Pengajar University Putra Malaysia, which is HPPM. She is going to share with us her perspective as a clinical psychologist, especially specifically one with a special interest in child and adolescent psychology. This pandemic has not been kind to us all, and it definitely has affected our children and adolescents very much. Let us listen to Miss Ajira.
Okay, thank you, Sean. Can you all hear me well?
Very well.
Yes, okay. So I don't have any slides. I'll just do this like a monologue of my own, okay? So, Assalamualaikum and good evening, everyone. My name is Nur Ajira Abdul Manaf. Like Sean said, I'm a clinical psychologist by training. And currently I'm working under the psychiatry department at Hospital Pengajar UPM, HPPM. So, the first time I heard about this sharing session was actually on this date, last month. So on 29th of September, Sean actually texted me early in the morning and it goes like this. Let me just read that. He said, "Good morning, Ajira. I was thinking of stuff and was going with this idea of holding a 1-hour webinar discussion session regarding mental health updates during this pandemic. How interested are you to be part of this?" It actually took me 19 minutes to respond, and of course, he caught me off guard early in the morning. But I responded lah. I said, "Good day, Sean. Sounds interesting. Sure, count me in." And then thumbs up, 100 and smile. I'm like, okay. So I was like, I didn't think much about it until today, and I was like, what was I thinking that day?
Ajira, you're muted here. Right, you are.
Yeah, somebody just muted me. Can you hear me?
Yes,
Yes,
it's
sir.
good. It's good.
Okay. So where was I just now? Yeah, and I was like, and I myself not too sure why Sean invited me for this, but I trust myself. I know I said yes for good reason, right? So, as you all might already know, October is the Mental Health Awareness Month, and I've been working. Actually, have been working with a few other associations and my fellow colleagues throughout the month for the mental health awareness. So today actually mark my last talk for October, and I think probably for this year juga lah. And I would like to end it with a small sharing with all of you today. Okay, so I hope you won't be bored by just see my face at that. Okay, so I am a clinical psychologist. Currently, I have to cover both cases from child and adolescent psychiatry (CAP) as well as adult psychiatry. So I guess this is like a little update lah on mental health during this pandemic from my experience as a clinical psychologist, I presume. Okay, so first thing that caught my attention during the pandemic, things that changed is actually the type of cases that I've been receiving. So yes, as we all know, there's an increase in depression and anxiety cases, not only for children and adolescent cases, but also adult cases. Okay, but I see a slight difference in terms of the presentation because it's related to the current situation of the pandemic. So, for example, depression. It's common to have symptoms like low mood, anhedonia, etc. But in the time of pandemic, when, for example, when we are ordered to isolate ourselves, especially during MCO, kan? So the situation itself kind of like sort of like causing the symptoms. So that is how it's slightly different, the different presentation of depression and anxiety. Depression in terms of we are not allowed to hang out with friends, no sports, social activities restricted, and then of course, with all of these being at home all the time, of course, we will have irregular sleeping time. And all of these are actually symptoms of depression. So that is how it becomes slightly different compared to the previously before pandemic itself. Okay, so in the case of anxiety, for example, in the current situation of the pandemic, the unpredictability, like Dr. Juliet mentioned just now, the unpredictability, like we're not sure how family members, whether they'll be safe, our friends, our financial status, whether it'll be affected or not. And then the change of routine, especially among children and adolescents. During this pandemic, school actually provide a lot of structure for children, and children prefer, they love structure. But with this pandemic, when there's a change of routine, there's a change of structure. So for those families who have a very strong structure, then they didn't have any problem. But the family who have little to no structure, they will have a lot of problems. They will come to us with a lot of behavior related problems and among other stuff. Okay. Other things that I've noticed in terms of anxiety includes social anxiety, for example. Currently, it's a hot topic among children and adolescents, especially because they're scared whether or not they are able to re-establish relationship with others. In extreme case, like one of my case that I'm seeing, for example, child adolescent case. 16 years old, female. She actually overdosed and has to be hospitalized when KPM suddenly announced there will be a physical class. So it can go to that extreme sometimes. And of course, the unpredictability of the COVID news, whether or not they'll get a vaccine, whether or not they'll be safe if they were to go to school and stuff. Okay, so the first one is in terms of the cases that I see, the increase of depression and anxiety. The second one, in terms of the type of case, maybe I can mention about the neurodevelopmental disorders. For example, neurodevelopmental disorders is inclusive of autism spectrum disorder, ADHD, communication disorders, and learning-related disorders like dyslexia, dyscalculia, and dysgraphia, and motor disorders. Okay, so the same goes for this cluster, for this class, because we do see a slightly different presentation of neurodevelopmental disorders during the pandemic time. Okay, because I think partly because of the great awareness on mental health related disorders. Maybe I can give you an example. Like there's two types. There's two types. The first one is the false alarm type. The second one is the gadget-induced type. Let me just break it down for you. The false alarm type is when we have cases where the parents are a little bit of a Kanchong type. The Kanchong type. Okay, so Kanchong type meaning they do self-referral, and they thought that the child have what is listed in the social media, of course, from the mental health awareness programs. Interesting thing about this type of cases is that the parents are able to tell you every single thing that actually ticks off everything from a very particular diagnosis in a DSM-5. Okay, it can be confusing for us as a clinician, because we have to what we see, what we observe from the child is not tally from whatever the complaints the parents actually tell us. Like for example, in the case of ADHD, some parents come to us and say, my daughter has ADHD. She cannot sit still, she cannot focus during online learning, she's unable to finish homework, she jumps here and there. So technically speaking, these are the symptoms of ADHD. But it doesn't tell you, see? Whatever their complaints are, it's not telling with the current presentation of the patient themselves. Like in the clinic itself, when parents tell like this, I observed the child was just sitting there, so it doesn't tell me. Okay, but we didn't dismiss them. Dismiss them like that. We just do a proper assessment, and then we psychoeducate them further. Okay, so that's the first one in terms of neurodevelopmental disorder, the false alarm type. The second type is the gadget-induced type. Okay, those who have high exposure to gadgets, they can appear to look like those like autistic. They can appear to be like that. Sometimes with isolated speech delay, communication problems. But from our standard clinical interviewing, the first thing that we ask is, I personally, the first thing that I usually ask is that, how long is the exposure? And sometimes it was so bad, some parents actually mentioned, oh, I'm sorry to say this, but I have to let my child with the gadget for one whole day. Sometimes it goes that bad. Okay, and sometimes it actually tempered with our diagnosis making, because it is not a pure diagnosis, because it appears to look like one, but it's not truly that. Okay, yes, they will have echolalia, they would mimic how cartoon speaks. There will be no eye contact. Of course, there's no eye contact. The whole time is with gadgets. So there's no need for proper eye contact with normal human beings. Of course, they will look like they always in their own world. Of course, gadgets in itself is like a new whole world, isn't it? So of course, there will be no imaginative play. They don't have the time for imaginative play, to be honest, if they're with gadgets, isn't it? There'll be no verbal. Of course, there's no need to speak. You just go through whatever you have in your gadget. Okay. So what we do with this kind of cases, usually we would do a little bit of parenting with the parents. We would suggest them to reduce the gadget use. and we would refer them for intervention with the occupational therapist to actually stimulate the sensory and come back again after 6 months. So to see whether is this a pure thing or was it induced by gadgets. Okay, so these are the children and adolescent cases. For adult cases, maybe I can share in terms of a very hot topic nowadays. It becomes very popular, the ADHD and bipolar. We do have a few referrals comes in that when that they think they have ADHD or bipolar, but when I assess whether it's more of the depression, which is common. It's good that social media has made help seeking for mental health more accessible, I would say. Okay, so that is in terms of type of cases that I see in my clinic. Maybe I can share in terms of my clinic itself. So in terms of my experience in the clinic, what I heard was in other settings, patients are scared to come for appointments. I think that's not the case here, because we have a very steady flow of patients, even during pandemic. Initially, we were actually scared for our last two. Let me just share, because you are all doctors and you don't understand why clinical psychologists scared for their life. So let me just break it down so that you will understand where I'm coming from. Okay, so as a clinical psychologist, my job includes assessment, diagnosis, and treatment. So in order for me to do a comprehensive assessment, it actually requires up to 2 hours close contact session with the patient. So actually, when there's a rise in cases among children, right, last time, it actually gives us a little bit of, it really scares us because the child that we are handling could be one of them. But we did it anyway, as we are still considered as essential services, right? So that is one in terms of assessment. Second is in terms of treatment, or what we call intervention or psychotherapy. Okay, psychotherapy will last up to 45 minutes per patient. So yes, every now and then we do receive notifications about our fellow clinicians, our psychiatrists, clinicians, our clinical psychologists who have close contact with patients. Yeah, it's kind of like a workplace anxiety for us as well, right? Okay, because we are uncertain, which patient we may have COVID, which one like safe to be with, and something like that. Okay, so also during this pandemic, maybe I can share in terms of the telepsychiatry thing. We are actually moving towards telepsychiatry or online consultation. There's always pros and cons on telepsychiatry. I think it depends on people. I personally prefer a physical session. I'm not going to go through the pros and cons of telepsychiatry, but because I see a lot of children and adolescent cases, so I have to do a lot of assessments, so I would prefer to do physical session. Which you receive more patients, and interestingly, during this pandemic, a lot of my patients actually say this. It's very interesting. It kind of like make me ponder for a bit. Actually, they actually say this: pandemic is a blessing in disguise. And it got me thinking, why? Is it? Yes, of course, it's a blessing because of this pandemic, I get to bring my children here to be assessed and to go through treatment before school starts. So I guess, yeah, it's true. Okay, that's more patient. And then yes, due to the nature of our hospital, we are actually we are based as a teaching hospital. So currently, a lot of students start to come in. More anxiety for us than ever, because previously we only see patients a little bit anxious on that, but now more and more students start to come in because this is the nature of a teaching hospital. We have to receive all these students. But yeah, they do follow SOP, but we're still anxious about all this. This thing is real. COVID is real. Pandemic is real. So give us a bit of anxiety still. Okay. And due to the many cases, we actually on our own. I'm not sure whether all of you know about clinical psychology practice in HPPM. Actually, we are concentrated with clinical psychologists. We have a total of 7 clinical psychologists with us. Okay, due to the many cases, we actually take initiative to take care of each other. So we spend every Friday morning just to check in with each other. And yeah, that has been helping, I guess. Yeah. And lastly, I would like to share in terms of my experience in my clinic. At some point in my time in my clinic, some of our dear MO colleagues have to be deployed for COVID ward for some time, and we are worried for them. And sometimes we do take an initiative to actually take turn and check on them. Okay. I think that's all for me. And I think I would like to sincerely thank the Malaysian Medical Association Selangor for this opportunity to share, I guess, an update about mental health in this pandemic. I think for me, it's more of like a self-reflection, to be honest. And it's pleasant to have people listening for my to my experience. Thank you so much.
Thank you, Ajira. Thank you, Ms. Ajira. But don't go away first because we have still got questions set up for you. But thank you so much. I think we all know that for children, play is a very important component of their developmental states. So I think it's something that we can actually see in the clinics that people are coming up with more and more symptoms that would be suggestive of autism, but it could be like as you mentioned, it's a gadget-induced symptoms situation. And I got one question over here though, and I was thinking about that. I was wondering if you have seen any differences among these children in only child families versus children with multiple siblings. Do families with multiple children come with less often frequency? I mean,
sorry, Sean. I kind of like I didn't get you the last part.
Yes. Sorry. It got cut off. I was wondering, how's the frequency of presentation to the clinic like? So, do you see more often children from only child families, or do you see more children coming in from families with multiple children?
I guess it's a mixture. For me, personally, I think it's a mixture. But I do see some custody cases. Sadly, during this pandemic, we do see a lot of custody cases. Yeah. So it's a mixture. Both also got.
Right. Thank you. And as you mentioned just now, the pandemic caused longer appointment sessions that may actually affect appointment sessions and affect people attending their own appointments. It's great that the HPPM is able to, as you mentioned, have a steady flow of patients. But what do you think can be done better in terms of, say, for other institutions where they are not able to get patients to the clinic appointments in time?
I see. Personally, in my own personal opinion, I would say the easy answer is to get more clinical psychologists on board. Because for HPPL, we have like 7 of us here. Like we are very much concentrated with clinical psychologists. So the easy answer, I would say, is to get more clinical psychologists on board. Okay?
Right. Thank you. Thank you for a very straightforward answer. We will require the Ministry of Health and Ministry of Finance to actually work with us on that account. Okay, let's have a look at the Q&A session. And there is one question over here. Have adverse mental health incidents increased since COVID-19 came to the scene? Is there any figures? I will open to maybe first Dr. Juliet.
Well, I can give you many figures, Dr. Gao, on that question, but the truth is it is increasing. The most that we see among healthcare workers right now is actually depression followed by anxiety. It's a lethal combination, if you ask me. I mean, it's been there all the time, but now during the COVID-19 era, it has just increased tremendously. I'll cite some studies and send to you, but it has increased tremendously, not just in Malaysia, but globally, right? So we are seeing suicidal ideations as well. What more with the lay people? But what's hidden is the fact that it does happen among the healthcare workers, the doctors, and it's not really highlighted because, well, maybe the progression is not there. There's help somewhere along the line, but we are worried. We are truly worried. Yeah. So yes, to answer your question, there are adverse effects. It's on the rise, and we need to do something about it.
Right. Thank you for that. We do have one more question for you, and this is something that is related to the part of the slides that you shared just now. So you mentioned about stigma towards healthcare workers with regards to mental health conditions. In your opinion, what can be done to ensure that our healthcare workers, or we usually call them frontliners, are able to sustain themselves in the workplace?
Oh, easy. You need very good peer support. You need very good organizational support. You need that support from other healthcare workers. Not every one of us cope with stress or anxiety in a certain one shoe that fits all manner. So when we identify co-workers and health workers who have issues, we should have enough peer support at ground level, at that first immediate level itself, to help them. And again, like I said before, to prevent this from getting worse, just simple training for doctors on active listening and identifying people with difficulties, doctors with stress, is simple training that could help them to identify co-workers who are going through certain issues during this pandemic. And of course, at other times as well, this itself will help. We doctors, we face the general public in different ways. People think just because we are doctors, we should know how to cope with all this. We should know how to handle stress. Doctors got depression. What are you talking about? You know, so with us, within our community of healthcare workers, if we can support each other with a little bit of training on how to help each other, I think it will be helpful enough for the start.
Right, thank you. Well, being able to check on each other is something very important. Both Dr. Juliet and also Ms. Achira have mentioned this in their talks, and this is something very important. But before we actually talk about looking at the other person, I'll have a question. One question over here that is actually, how do we identify red flags? How do we know if the person is actually heading towards mental health burnout or mental health conditions?
If I may answer that, to start out with, there will be a marked change in the personality, the demeanor of the person, right? That will be the first red flag that you'll be seeing with a co-worker that you've been working with for so long. If you see personality changes, and I'm not talking about physical fatigue and such alone, the anger, the frustration, the snapping out easily, all this shows something is going on, right? These are all identification factors. Often when, in a group of workers, when someone is angry or someone is, having a change of personality, in our culture, it is just dished as, oh my God, what's wrong with this fella? It is just dished away. It's put away. But these are all signs that the stress is building up. There's something happening. So a simple, I wouldn't say task force, but a simple question about how are you doing? What's happening here? I noticed that you've been very frustrated lately, or you've been losing your temper a bit easily lately, can just open up a conversation about what's happening. Yeah, I hope that answers your question, Sean.
Of course, and that's something very important, because when we talk about caring of other people, we also have to notice, observe the other persons, and also, and if you have been seeing them, very frequently, you have known their personality, their character, how they respond usually, and if there is some certain changes to it, then maybe it's time for us to increase a bit of our concern to the person. Thank you. Then the next question that we have is, how do we actually seek help? So we know that sometimes we have got this, someone has got these personality changes.
Yeah.
What can we do? Who can we approach?
You never record, that's the most important. I wanted to see, but then somebody tomorrow MMA.
Dr. Siva.
Oh.
Okay.
I'm so sorry.
All right, so how do we seek help?
The idea of seeking help depends on how severe the situation is. I always feel that if it is curbed from the beginning, there's a platform for everyone to talk about what they're going through. You may not need to actually go and see a professional and seek help, right? So the peer support, again and again, the peer support is very, very important, right? But ultimately, what is needed is actually to first have a teamwork group discussion and see if this person really needs help. And then, yes, refer to the counselors in the department, the psychologists now, and of course, the psychiatrists. I'm not putting the psychiatrists away just because Ms. Noor Ajira and me are not from that side. But the truth is the stigma is higher, right? When you refer to a counselor, you're just telling them, go talk to someone about this. Just narrate your feelings, just let it out. Let's see what can be done about it, right? So that's the idea of referral. Often at work, when we say refer to the specialist or refer to the professionals, it's associated with a stigma already. You have some problems, you cannot cope, you have issues. And that becomes something that prevents any doctor from seeking help. So put counselors, put clinical psychologists, put people there, put your own teammates, those who have good active listening skills, to go and start the conversation. Talk about it. Have an open forum about talking about how you're feeling. We all know what kind of stress we go through, minus the COVID era itself, right? So now with added on, just start the conversation, right? But if you're looking for a real formal referral, Sean, yes, get the head of department to write out, send the person for counseling, and do what is necessary.
Okay, I have one very interesting question here. This came from a GP. Because we do have got 3 separate groups of people, counselors, psychologists, and also psychiatrists. Who should a person be referred to, and at which point of time should the person be referred to?
Sorry. Before any one of you answer, let me just clarify this. This is specifically the pathway for doctors or for general people? I don't know how to answer this question, like, are these for doctors ke macam mana?
This question, I mean, because this is an MMA one, I think most of our attendees are doctors. Let's answer let's answer the doctor way.
Okay.
Ms. Noor Ajira, do you want to first explain to them?
Okay. I think what we did here, Sean, correct me if I'm wrong, we do receive cases from FMC itself. So FMC, we come to psychiatry, and then psychiatry we actually review these patients. This is the general pathway, okay? So the FMC will refer the patient here. It's either FMC or the GP, general practitioner. So the referral comes from them and then to psychiatry itself, because if there's any mental related problem, so they will refer to psychiatry. Psychiatry would actually review first, the MO would review, and then the PSI will, the specialist will review, and then they will see whether this is a clinical case or not. If it's clinical related disorder, if it's mental related disorder, then it will be under psychiatry department. It will be handled by psychiatrist and a clinical psychologist. if the MO when the MO review and the psychiatrist think this is not a clinical cases, but still warrant a mental health professional services, then we would actually refer to our fellow counselors colleagues in the hospital. Correct me if I'm wrong, Sean. Is that the correct pathway?
Yes, if I may add on to that, to me, to all the GPs out there who are wondering whether to send the patients out to, or whoever, to psychologists, counselors, or psychiatrists, my answer is start and send anyway. It does not matter. It does not matter. What matters is that they get some help, right? And if a psychiatrist feels that no, this should be going to a counselor, there's no disorders here, then yes, fine, right? And vice versa. But just refer to any mental health facilities that you know about near you.
Okay, thank you. Thank you both for your input over here. If you have noticed the comments coming out of my name, that's because some other people are using my link, so the names are actually short. Okay, I think we all have gotten some really great response from you guys today, and I think our sharing today has been really fruitful and has been quite illuminating for me myself. We are nearing the end of our session. It's almost 9 o'clock. If I may, I would like to invite both of our speakers, perhaps to come up with 2 sentences or 50 words, to sum up what you wish our participants to actually take home as take-home message. Maybe Dr. Juliet would like to start first.
Oh, I would just advise everyone to talk about mental health openly. There's no stigma to it. It's not wrong. If you have a headache, if you have a pain at the back, you will talk about it. You will go and get medication for it. So just like that, talk about mental health openly. That's my advice.
Right, thank you very much. Actually, this webinar was actually arranged as part of the Mental Health Month, which is October. So we are trying to encourage people to speak up more, to raise the profile, raise the awareness of mental health conditions, so that we can actually bring in more resources to increase our advocacy work on this. Ms. Najira, what would you like to our participants take home?
Okay, so since this is for the medical association, so all of you are medical doctors, so I would like to say this. Mental health starts from you all actually. Like if you all didn't break the stigma, it won't actually break in the society. So you all have to understand mental health problem is the same like Dr. Juliet mentioned earlier. It's the same like diabetes. If diabetic, then you have to take medication. You have to go for therapy, whatever therapy you need to go for. Okay, so you all are the first step for mental health to break the stigma on mental health. That's what I would say. Yeah.
Right, thank you, Ms. Ajira. I think WHO has defined health as equal parts physical health and also mental health. To make sure a person is actually healthy is not just to make sure that the kidney, the lungs, the hearts are healthy. It's also a matter of getting the mind being to be healthy as well. Mental health is something very important. We all have to be aware that mental health is not just disorder, but it's also a condition whereby the person's mind is actually able to actually produce and to achieve the potential that the person can actually achieve. Okay, so once again, I would like to thank both of our panelists for attending here today, and so thank our participants who submitted questions here. This is the first webinar of our MMA Selangor webinar series. We are going to come out, we're going to work together, we're going to come out with better, other relevant topics for us to come out so that we can stimulate the minds of our healthcare professionals and so that we can actually push our country and our healthcare professionals towards the direction of nation building. Thank you for your participation. I wish all of you a good evening. Thank you.
Thank you, Sean. Thank you, everyone.
Thank you, Sean. Thank you, everyone.
Thank you. Okay. Right. So thanks both of you. I will be in touch via WhatsApp.
Yes, and good to meet you, Miss Noor. Keep in touch. Take care.
Okay.
Oh, I didn't unmute myself.
It's okay.
Okay, bye, Sean.
Bye. Thanks.